Well, now it is time for today's health headlines. And, you know, the measles outbreak, it's actually worsening in our area, and how stress can affect your allergies.
Some scary stuff there. Dr. Evelyn Manea is back on the couch to fill us in, and we were just talking about this. Cases of measles on the way up. What's going on?
Well, you know, it's the venerable, well, I'm not going to vaccinate my child because, you know, of autism, which has been proven time and time again that it does not, there is no association with it. Most importantly, what can you do as a parent? If your kid is sick, do not send him to school. If your kid has a high fever, if your kid has a little bit of a rash, does not feel well, don't send the child to school. Don't ride on the trains. Call your pediatrician, see what's going on. Try not to, you know, pediatricians also have sick, you know, appointments, and they also have well appointments. Don't just walk in. Don't go to an emergency room. There might be pregnant women there, especially pregnant women, and the elderly are more susceptible to the measles, especially younger children.
Yeah. Well, now health facilities are also being blamed in part, as you just said, for the outbreak. So what can they do other than provide a different waiting room for those people who think they're ill?
Well, you know something, I think that the triage people is very important. You know, triage the people, you know, look at them, see if they're really sick, and put them somewhere else. And it's transported. See, everybody thinks it's contact, and it really isn't. This is really transported by respiratory, so it's the sneezing, it's the congestion, it's the coughing on top of you, and that's what it is. If you have a cough, try to stay away from other people. Cough into your elbow. You know, don't spread it everywhere. It's very hard to control, especially children, but at least for the adults and the elderly and the pregnant ladies that are sometimes in the emergency room, you have to be cognizant of that.
Yes.
Well, now let's talk about some good health news. So fruits and veggies we all know are good for us, but maybe there's another reason they're good for us?
Yes, allegedly it decreases the risk of death. Now, you have to understand.
I know. Where's my fruit salad?
I know, but it's like 7 to 9 portions of fruit and veggies. That's an awful lot in a day's time, and it only cuts down that risk by 42%, okay? And it's not the same thing as doing canned vegetables or canned fruits either, and veggies do better than fruits.
But it's so expensive to have a diet like that that's rich in fresh vegetables and fruits.
But think about this, okay? Who really has enough time to do 7 to 9 portions?
There's no way.
Okay, and in general, those people are probably healthier, so you are decreasing your risk for death. But, you know, in the study, it's very, very interesting. I think that one of the things that is the take-home message out of all the goopity goop, okay, is that fruits and vegetables do help. You know, natural things, and you're right, it's very, very expensive. It doesn't have to necessarily be organic, but it does have to be fresh. It cannot be canned.
What about juices?
Juices do not do it either, okay? And juicing does not do it, I know, I know. It has to be raw vegetables and raw fruits. Make sure you wash them, by the way.
Yes, absolutely.
Okay, because of the contaminants.
Well, now, stress is bad, but it can also worsen our allergy symptoms. How do these go hand in hand?
Well, I think that stress, as we already know, okay, first of all, you're miserable to begin with. That also stresses you out. You don't feel good, you're congested, you're not even sleeping or anything else like that. But stress really decreases your immune system, okay? As I just heard somebody else sneeze. Okay? But, you know, it does decrease your immune system, and unfortunately, your allergies will just get worse. The symptomatology will get worse. And the rates of relapse also get worse in this particular study. So it's very interesting. So meditate, put your Zen on, if you can, okay, and try to really decrease your stress and change your lifestyle a little bit.
Yeah, which is hard to do in the city, but it's absolutely crucial that we do it.
Yeah, absolutely. Absolutely, for a myriad of other reasons.
Yes. Okay, well, new research says that aspirin could help people with colon cancer.
Right, but this does not mean go ahead and take an aspirin every day, okay? So I caution people first. And in this particular study, it was people that the tissue was actually analyzed, and it was called an HLA antigen 1. Okay, and what that means is there's a specific protein on this tumor, and we think that aspirin, the way that it works, is that it's going to prevent the tumor from going everywhere else. So metastases and also new tumor growth. But it's only specific to those people that have this particular protein.
And, lest we forget, aspirin can jack up other parts of the GI tract.
Right.
If you're sensitive to that, it can affect the stomach.
That's right. And it can it can lead to bleeding and things like that, especially in women. So we caution people, but wouldn't this be a cheap, really the cheapest really solution, okay, to really, instead of doing targeted chemo, let's say for example, to do something preventive, finally, so cheap and easy and over the counter, no less.
You'll have to keep us posted.
Yes, we will.
Dr. Evelyn Manea, thank you so much for joining us on the couch this morning.
Absolutely.